This is Dr. Shumanahak. I'm a consultant fetal medicine.
Hello, I'm Dr. Dipanjana Datta. I'm a consultant in genetics.
So, as we all know, 21st March is dedicated towards World Down Syndrome to create awareness about this condition.
But what is exactly this condition? This condition is a condition where an individual has an extra chromosome 21 either partially or completely.
So, for this, these individuals may look differently and they may have various physical conditions which may include cardiac malformations and intestinal malformation. They may develop certain cancers later on in their life. So, it is important that the parents they get to know prenatally whether they are having babies with Down syndrome.
Down syndrome screening is something that should be done for all women of all ages. It was believed, and it is a stereotype, that only older women can have children with Down syndrome. But actually, recent data suggests that anybody can have Down syndrome. Now, most of these Down syndrome children, this condition is not heritable. In 95% of the cases, the extra chromosome is due to a condition called non-disjunction, while in about small amount of cases, it can be because a small amount of the chromosome is piggybacking, and this is called a translocation. Parents of balanced translocation carriers can have children with Down syndrome, but the chances are very less.
So, these chromosomal conditions, these can be detected prenatally, and we do it with the help of simple needle tests. These are confirmatory tests which tell us exactly whether the fetus inside the mother's womb is having Down syndrome or not. So, how do we do it? With the help of ultrasound, we insert a needle into the maternal tummy, and during 11 to 13 weeks, 6 days of gestation, we take out a small quantity of tissue from the placenta, and this is sent to the lab for analysis. The lab gives a confirmatory report whether this baby is going to have Down syndrome or not. Next, we can also detect this condition after 16 weeks of gestation, where we extract some fluid in which the baby floats, again through an ultrasound guided needle, and this fluid is sent to the lab who gives the diagnosis whether this baby can have Down syndrome or not. Now, do we do these confirmatory tests for all women? No, we do not do it for all women. We do it only in certain cases. And why do we not do it for the entire population? Because firstly, these tests they carry a small chance of miscarriage, that is 1 in 1,000, and also there are cost issues. These tests are expensive, so we do it for certain women. When the first trimester screening test and the quadruple test, if these tests are of high risk category, we proceed towards the confirmatory test. We do it also if the NIPT or the non-invasive prenatal testing is positive.
It has been said that advanced maternal age can be a risk factor for having a child with Down syndrome. But understand, this is not really a direct risk. This is an individual risk. Basically, as women get older, there is chance of oocyte aneuploidy. By this, what we mean that our oocytes, or the eggs that we produce, can have these kind of chromosomal problems that can translate into having children with chromosomal abnormalities, Down syndrome being extra chromosome in chromosome number 21. But this is actually a myth, because even a 20-year-old girl who has aneuploid eggs can also have this kind of a outcome, and also this aneuploidy can be in the sperms as well.
So, if the age of the mother is of the elderly category, that is, if she is 40 years or above, she can ask for a confirmatory test. But that doesn't mean that we will not do anything to women who are of the younger age group. We will do a screening test for them, and then if the screening test is positive, we will proceed towards the confirmatory test, that is the needle test. Now, there are certain ultrasound markers which, if we see, and if we see in the scan, we can ask for a direct confirmatory test, that is the needle test. These are absent nasal bone, tricuspid regurgitation, and there are certain second trimester ultrasound markers which may also point towards Down syndrome, and the doctor may decide to go for a confirmatory test in this condition.
Well, the answer lies in the parents itself. Currently, we have children with Down syndrome who live for 60-65 years. Since this is a disease which has been investigated very well, we know how to manage it. Well, there is no cure, but there are managements. From the birth, we can start with the cardiac issues if there are any. We can move on to the gastric issues, the neurodevelopmental issues can be addressed through physiotherapy, occupational therapy, behavior therapy, and we have many mothers who have known from prenatal testing that they have children with Down syndrome, and they have gone ahead and delivered the child, and because they had the support system with the doctors and the patient advocacy groups, they exactly knew what they were up to, and they are bringing up children with Down syndrome. The decision lies in yours. What we can provide you is an information, and this information can be a key to manage your child if you decide to have one.
Down syndrome babies can have a very fulfilling life, and they can achieve their goals if they are provided with good resources and good support system.
It is your choice, and it's an informed choice that helps us to lead a healthy family life. We hope that in such cases or dilemmas, you would reach out to us at Bhagirathi Neotia Women and Child Hospital.